Managing your medication can feel overwhelming, whether you're on a short course for a cold or taking meds long term for a chronic condition. From understanding what you're prescribed to making sure you're taking it correctly, every step plays a part in ensuring your treatment is effective and safe. Missing doses, dealing with side effects, or even just figuring out how to store your meds can all be challenging if you're not prepared. That's why having a clear plan and knowing what to do when you get your meds can make all the difference. In this video, we'll walk through 10 essential tips that will help you stay on top of your medication routine, feel confident about your treatment, and most importantly, keep your health on track. Number 1. Know your prescription. Understanding what you're taking. Before you even pick up your meds, take some time to really understand what you've been prescribed. Don't just trust the doctor to know it all. Ask questions. What's the medication for? How does it work? What are the common side effects? Having this basic info can make a huge difference, especially if you're managing a chronic condition. It gives you a sense of control and helps you monitor how your body reacts to the meds. Plus, it's always good to know what you're putting into your body. If you're unsure, don't hesitate to get clarification from your healthcare provider or pharmacist. Getting your medication isn't just about the prescription itself. It's also about how that specific drug fits into your broader health picture. If you're juggling multiple meds or supplements, it's important to know how they all interact. You don't want to accidentally mix things that don't work well together. And hey, it's your health, so there's no such thing as too many questions when it comes to understanding your meds. Number 2. Confirm the correct dosage and instructions. Once you have your prescription in hand, the next step is making sure you know exactly how to take it. This might sound simple, but sometimes instructions can be tricky. Does it need to be taken with food? How many times a day? Can you take it at night or should you stick to mornings? Double-checking these details can save you from making common mistakes, like missing a dose or taking it at the wrong time. If the label on the bottle is confusing, your pharmacist is just a phone call away. It's also a good idea to ask if there are any specific instructions that aren't listed on the bottle. For instance, some medications shouldn't be crushed or cut, while others need to be taken whole. Missing out on this information can make the drug less effective or even dangerous. So make sure you have a clear understanding of how, when, and how often you should be taking your meds. Getting it right the first time is key to ensuring you get the most benefit from your treatment. Number 3. Keep a medication schedule. Consistency is key when it comes to medication, especially for things like antibiotics or chronic condition treatments. It's not enough to just take your meds. You need to take them at the right time and on a regular basis. A missed dose here and there might seem harmless, but it can reduce the effectiveness of the treatment and even lead to complications down the line. That's where a medication schedule comes in. Using a simple pill organizer or setting alarms on your phone can be game changers in staying on track with your meds. If you're tech savvy, there are plenty of apps that can help remind you when it's time to take your medication. Some even track your doses, so you know if you're sticking to your schedule. Whatever method you choose, sticking to a routine ensures that you're getting the full benefit of your meds, with fewer gaps in your treatment. And let's face it, life gets busy. Having a reminder can save you from those "did I take it or didn't I" moments. Number 4. Understanding possible interactions. If you're on more than one medication or you take supplements, it's super important to know how they all interact. Even over-the-counter meds and herbal remedies can mess with your prescription drugs. For example, some medications can cause drowsiness when combined, while others might cancel each other out or lead to more serious side effects. Being aware of potential interactions can prevent these issues and keep you feeling your best. A good rule of thumb is to be totally upfront with your doctor and pharmacist about everything you're taking. This includes vitamins, herbal teas, or even seemingly harmless pain relievers. If you're unsure, don't guess. Ask. Your pharmacist can cross-check your medications for any potential interactions. It's always better to be safe than sorry when it comes to mixing meds. So stay informed and keep an open line of communication with your healthcare team. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 5. Plan for refills and manage your stock. Running out of your medication can be a real hassle, but more importantly, it can have serious consequences for your health. If you're managing a chronic condition, missing even a day or two of meds can set you back. That's why it's essential to plan ahead and keep an eye on your supply. Mark your calendar or set a reminder for when it's time to refill, so you're not caught off guard. Many pharmacies even offer automatic refill services or text reminders, so you never have to worry about running out. Another great tip is to always keep a small buffer of medication, maybe a week's worth, just in case there are any delays in getting your prescription refilled. If you're traveling, make sure you pack enough meds for your trip plus a little extra, just in case plans change or you get delayed. Managing your stock might seem like a small detail, but it makes a big difference in keeping your health routine smooth and uninterrupted. Number 6. Check for side effects and report issues. Every medication comes with the potential for side effects, some of which are mild and others that can be more severe. It's a good idea to familiarize yourself with the common side effects of your meds, so you know what to expect and what's normal. Mild nausea or headaches may go away after a few days as your body adjusts, but if you're experiencing anything unusual or concerning, don't hesitate to reach out to your doctor or pharmacist. It's important to listen to your body. If something doesn't feel right, whether it's dizziness, rashes, or more serious symptoms like trouble breathing, get in touch with your healthcare provider immediately. They might adjust your dosage or switch you to a different medication. Keep in mind that side effects can sometimes show up later, even after you've been on the medication for a while. So stay alert and proactive about reporting any issues. Your health team is there to help you feel your best, and they can't do that if they don't know what's going on with you. Number 7. Follow up with your healthcare provider. Even after you've started your medication, your healthcare journey doesn't stop there. It's important to follow up with your doctor or healthcare provider to track your progress. Medications don't always work the same for everyone, and sometimes the dose or the type of medication needs tweaking. If you're not feeling the benefits or if side effects are becoming a problem, a follow-up appointment is your chance to talk about these issues and make adjustments as needed. Don't wait for your next scheduled appointment if something feels off. Reach out sooner rather than later. A quick call or visit can save you from prolonging discomfort or worsening your condition. It's also important to note that some medications require routine blood work or other tests to monitor their effects on your body. Stay on top of these follow-up tasks and don't hesitate to advocate for yourself. If your current treatment isn't working, your healthcare provider can work with you to find a solution that does. Number 8. Store medication properly. How you store your medication can affect its effectiveness. Not all meds are created equal when it comes to storage conditions. Some need to be kept in cool, dry place, while others require refrigeration. Always check the label for storage instructions or ask your pharmacist when you pick up your meds. For instance, antibiotics or insulin often need to be kept cool, while other drugs should be stored at room temperature, away from moisture and direct sunlight. Be mindful of where you're keeping your meds at home. A bathroom cabinet might seem convenient, but the humidity from showers can actually degrade some medications. If you have kids or pets, make sure your meds are stored out of reach and in a safe spot. The last thing you want is an accidental ingestion. Keeping your medication properly stored ensures that it remains potent and effective throughout its prescribed period. If you're ever unsure about the best way to store a particular medication, your pharmacist is a great resource for guidance. Number 9. Dispose of unused or expired meds safely. Once your meds are expired or no longer needed, don't just toss them in the trash or flush them down the toilet. Improper disposal could be harmful to both people and the environment. Medications that end up in landfills or water supplies can contaminate the soil and water, potentially causing issues for wildlife and even humans. Instead, many communities offer medication take-back programs which provide a safe and responsible way to dispose of unused or expired drugs. If you don't have access to a take-back program, your local pharmacy might also offer disposal services. Some pharmacies have kiosks where you can drop off old medications, and others sell special medication disposal bags that neutralize the drugs and make them safe to throw away. The bottom line, don't let unused meds sit around in your house, especially if you live with kids or pets. Properly disposing of them reduces the risk of accidental ingestion and helps protect the environment. Number 10. Be your own advocate. Ask questions and stay informed. At the end of the day, you are your best health advocate. Don't be afraid to ask questions if something doesn't make sense or if you're unsure about your medication. Whether it's a concern about side effects, interactions with other drugs, or the cost of your meds, it's important to stay informed. Remember, no question is too small when it comes to your health. Your pharmacist and healthcare provider are there to support you. So take full advantage of their expertise. Also, stay proactive by keeping up with any updates or changes related to your medication. For instance, new research or changes in guidelines might affect how your medication is used or prescribed. By staying informed, you're not just following a prescription, you're taking an active role in your healthcare journey. Being educated about your meds will help you feel more confident and in control, making the whole process smoother and less stressful. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!